listening to the Pharmacy Podcast Network.
Hello, my name is Nira Kadakia. I'm the 2023-2024 chairperson of the APhA Preceptor SIG Education Committee. I'm pleased to present the latest episode of the Preceptor SIG podcast. Today's episode is for preceptors looking for advice on integrating learners into busy community practice settings and maintaining a good learning environment. With me, I have two experts, Stevie Veach and Olivia Strain. Dr. Stevie Veach is Clinical Associate Professor at the University of Iowa College of Pharmacy and Clinical Pharmacist at Mercy One Pharmacy in Dubuque, Iowa. She earned her Doctor of Pharmacy degree in 2006 from the University of Iowa and completed a PGY1 Community Pharmacy Residency with the University of Iowa and Mercy Family Pharmacy. Dr. Veach has precepted Introductory Pharmacy Practice Experience, or IPPE students, Advanced Pharmacy Practice Experience, or APPE students, and PGY1 community-based residents in the community pharmacy setting for the past 17 years. Currently, she coordinates the Doctor of Pharmacy Community IPPE experience at the University of Iowa, and she also coordinates and teaches courses focusing on non-prescription medicines and self-care for both Doctor of Pharmacy and undergraduate students. Dr. Veach's primary professional interest is advancing patient care services delivered by pharmacists in the community setting. Olivia Strain is a medical science liaison with the GSK Vaccines Field Medical Team and is responsible for covering Mississippi, Walgreens, American Pharmacists Association, and National Alliance of State Pharmacy Associations, or NASPA. Dr. Strain is a Mississippi native and received her Doctor of Pharmacy degree from the University of Mississippi School of Pharmacy. Prior to joining GSK, Dr. Strain practiced for over 17 years with Walgreens, most recently as a clinical services pharmacist and residency program director. Additionally, she held appointments as a part-time clinical associate professor with the University of Mississippi School of Pharmacy in Jackson, Mississippi. Thank you both for being here with us today. So I'll start off with some questions for both of you, just to hear your perspectives on precepting in community pharmacy settings. Dr. Strain, I think a challenge that newer preceptors or preceptors who are new to a site face is knowing how to incorporate their learners successfully and meaningfully. How have you successfully integrated students into your practice setting?
Hi, Nira. Great question, and thanks for having me today. So for me, that really came down to the diversity that my rotation offered. I had a very non-traditional role, and so I really spent one day a week in a traditional community pharmacy setting, one day a week in a specialty pharmacy setting, and then the rest of my time was devoted to initiating, growing, training on new clinical services. So immunizations, both in the store and off-site, MTM services, COVID testing, COVID immunizations, anything to do with clinical services. And so part of that means that students were not always directly with me. So they may be at an off-site clinic with another pharmacist. They may be in a different specialty pharmacy with another pharmacist so that they could see different therapeutic areas. We even involved our district managers or DMs so that they could see a little bit more of a leadership aspect of what Walgreens runs like, what's important both in the front end of the store, in the pharmacy, why we would do what we do, where, maybe some of those goals or metrics were coming from, how to motivate a team, how to handle discipline. So all of the things that are involved within a pharmacy that maybe they don't get to see on some of their more traditional rotations. And so for me, a lot of it was not only spending time with me, but also giving them time with others that maybe have more advanced knowledge or more experience, since my role was very diverse. And so putting them with others who were more specialized in some of those settings really gave them a way to be successfully integrated across multiple practice sites or practice settings.
Thanks for that. I think it's interesting to see all the different aspects of a setting. And sometimes when we're in practice, we don't always get to see all the nuances that someone may have. So thanks for sharing that. Dr. Veach, learners come to rotations with a variety of prior experiences, knowledge, and skills. Knowing this, how do you create and maintain a positive learning environment that builds upon what a student has learned previously?
Thanks, Nira, and thanks for having me on the podcast today. So for my community pharmacy IPPE or APPE rotations that I've precepted over the years, I always start off the first day with a questionnaire for the student. And I like to ask them, what are your upcoming rotations? What experience do you have in the community pharmacy setting? And also I have them list some goals that they want to get out of the rotation. I think that really helps us set off the right foot because you'll have a variety of learners. Some may have been technicians and worked in community pharmacy prior to coming to pharmacy school, and others maybe have had no prior experience. And if all of us take a minute and just think about our first day in community pharmacy, it was probably pretty overwhelming. It's busy. There's a lot of things you don't know yet. So for those learners with less experience, you really have to tailor the learning experience to them. Beyond that, I try to have a list of activities for them to participate in, and then we can kind of pick and choose which ones they can jump right into and which ones we maybe need to spend a little more time having them shadow and work their way up to doing maybe like a CMR for a patient if they've not done that previously. So I think that having them set some goals and give us their information, we can tailor the rotation to meet their level of learning and make it a positive environment for them.
Yeah, that all helps the learner have buy-in to what they're doing on their rotation and makes them more engaged with their learning too. So I loved hearing that from both of you. Dr. Strain, how do you provide timely and continued feedback to your learners, and how does this change for different levels of students like IPPE and APPE students?
Yeah, excellent question. And actually, one of the things that I include on that survey that we were just talking about, that questionnaire prior to rotation, is questions about how do you like to receive feedback? Do you want it in the moment? Do you want it to be more formal, sit down so that you can be prepared for it, different things like that. And so I actually did feedback in multiple ways with every student. So specifically for APPE students that would be with me for a month, I would do Monday meetings so that we could talk about maybe how the past week went and then what this upcoming week looks like, and then provide feedback and answer questions from the week that they just had, as well as talk about expectations for the week coming forward. And then obviously a midpoint and endpoint that were a little bit more formal evaluations, and they have those questions in advance, and so they know what to kind of really expect from that. But also, I was a big fan and am a big proponent of in-the-moment feedback, especially in a community pharmacy setting. So maybe they had an excellent interaction with a patient at the counter, and it was on a Tuesday, and then I wait till the following Monday to have that formal feedback discussion with them. They may not even remember that discussion that they had with the patient at the counter. But if I immediately pull them to the side and talk about what went well, ask how they thought it went, and what maybe they could have done differently, or what they were excited about as far as that interaction went, then it means a little bit more doing that interaction and that discussion right there in the moment. Also, because my IPPE and APPE students were with other preceptors at times or with the DMs, I would ask those preceptors or leaders to give them feedback both in the moment and provide formal feedback to me to use during endpoint and midpoint as well, so that it was not just their perception of what I thought I was hearing, but it was directly coming from the people that they had been working directly with.
Olivia, if I could add to that too, I love the in the moment feedback, but one of the hardest things for preceptors is giving that constructive feedback or that not so positive feedback. And I feel that's where a lot of preceptors really have a difficult time. But if any of us are parents, or maybe we have pets, we know that you have to correct behaviors that are not appropriate or maybe that need improvement, correct them right away in the moment, as you said. So I think not shying away from giving that constructive feedback and sometimes even putting it on the learner, like you said, asking them how they think they did, I think will help really solidify that they can make improvements in their skills and their ability and perform better in the future.
You shared that it can be challenging to give feedback in the moment, especially in a community pharmacy setting. Another challenge that maybe some preceptors face in the community setting is teaching interpersonal skills. And we know that while these are challenging to teach others, they are so important in our profession, especially in a community setting. Dr. Veach, how have you helped a learner improve an interpersonal skill like supporting a patient who is visibly upset at the pharmacy?
That's a great question. And that can be one of the most difficult things to teach or give feedback on. I think it starts with allowing them to mock situations. And then maybe it's not even that really difficult situation like the upset patient, but have them do some mock counseling with you so that you know how they're going to interact with individuals. And then, it's that kind of see one, do one, teach one, but show them how you would maybe handle a situation, then allow them to be in a situation while you're directly observing. And then, once you feel comfortable with their skills, then you can step back and maybe precept from a distance. If it is a situation, as you described, Nira, where maybe somebody's upset or there's conflict, I do try to step in pretty early and let the student know that I'm there to support them. Maybe I won't take over, but maybe I'll come up to the pharmacy counter where maybe the discussion's happening, just so they feel supported. I think that's the biggest thing, is to show that you're supporting them. And if I feel I need to step in to take over that situation so they can observe how I would handle it, then that might be the best situation. I never like to make my students feel completely uncomfortable. I do like them to step outside their comfort zone a little bit, but we don't want to put them in a situation where they feel totally uncomfortable. So I might try to de-escalate the situation.
That's a really great explanation and some good tips of how to overcome that challenge in that particular setting. Okay, so the next set of questions I have is for both of you. As pharmacist preceptors, we have a lot of different hats that we wear, and we may sometimes feel as though we're being pulled in many different directions. What do you personally find helpful to prevent burnout and strengthen your resilience and well-being? And related to that, what advice do you share with your learners about burnout, and how does this change for different levels of learners?
As you probably noticed from my bio, health and well-being plays a huge part of my life. I'm really into running, triathlons, sports, doing things with family and friends. And so for me, preventing burnout and strengthening resilience and well-being is all about setting some time for yourself. And I definitely say setting the time, because sometimes you have to be very intentional about that, especially when you're looking at different levels of learners. And so from an IPPE, your rotation may be very short, and so you may not be able to set some time to take out of that rotation. It gets a little bit longer with APPEs, and then especially as you move into residency, if that's the route that you go, you have to be very intentional about scheduling time for yourself to really reset, recharge. So it's really about resetting, re-energizing, doing whatever it is that helps you get back in that frame of mind that is resilient and strengthening your well-being. So whether it is exercise, baking, being with family, traveling, seeing friends, having a, once a month or once a week dinner out with a group of friends, whatever it may be, just choosing to put that on your calendar, especially if, like I said, you're a resident, actually sticking it on your calendar so that it has to happen, and really just treating that as time that is blocked off. Again, another thing that comes to mind is being willing and able to say no or not right now. And so that's something that I talk to students and residents about all the time is even if something is a really good opportunity, if you say yes to it, you're essentially saying no to something else. And so just really protecting some of your time so that you're not saying yes to everything and stretching yourself too thin. And sometimes that means saying no. Sometimes it means not right now. And sometimes it means finding a happy medium. So maybe you can do part of what's being asked, but not the whole thing. Maybe you were asked to create a presentation and deliver that presentation at a conference, but really you only have the bandwidth right now to do half of that. Maybe create the presentation and then let someone else actually travel to the conference and give it, or vice versa. And so just finding ways that you can still feel fulfilled, but without putting too much on yourself at once.
Olivia, I think that's so great. I think if we can emulate for our students good work-life balance and good well-being and resilience, I think that goes a long ways with learners, and not only just demonstrating it, but having those conversations with them. I think another thing that helps too, community pharmacy can be busy, it can be stressful, but to really try to focus on the positive interactions that you have. They always say a negative interaction will have, much more impact on somebody's memory and mind. But if we can flip that and really reflect on, hey, you really helped out that patient today, or, you had so many people thank you for your time and your service. So I think if we can teach students and learners to really appreciate those moments when somebody really appreciated their time, their efforts, I think that will help build that resilience within them as well.
Yeah, thank you both for sharing that insight. I think well-being and resilience and taking care of ourselves is something I'm still working on even in practice. So I appreciate hearing those lessons reiterate what you just shared. So those were all the questions I had for you. Is there anything else either of you would like to add?
I think one of the biggest things that I've found that learners really appreciate that sometimes in the busy, fast-paced community pharmacy we don't think about doing is just letting them see what we do, talking out loud what it is that our thought process is. So just really they want to know how you think, how you handle situations. And sometimes we're just delegating, go do this, look up that. If we help them see, why do I address some drug interactions that come up versus others? And how do I make that clinical decision about which ones I feel are worthy of calling the doctor on versus which ones I might just educate the patient about? If we can really help describe our thought process, how we think and how we handle situations, learners really appreciate that. So rather than just giving them tasks to do, if we can train them and teach them how we make clinical decisions, they're very appreciative of that, and that'll help them go a long way as well.
Kind of piggybacking on that is just showing students, they probably come in, especially IPPE students or even APPEs, come into a community rotation with certain thoughts in their mind about what that rotation will be like. And they think that all community rotations will be basically the same. But take this opportunity to show these students how creative, community pharmacy can be, showing them all the different options that are available there. And you may think, oh, well, my practice isn't like what I just described my role was. But I bet you do way more than you think that you do. And there are way more opportunities to show these students different ways to get involved. And it doesn't have to be directly in the pharmacy. If you're involved in other organizations and state associations or national associations, pull them into those meetings with you. If you're going to go be on a APhA SIG meeting call, allow them to sit in with you and see different ways to really get involved and grow both as a professional instead of just a student on rotation.
All right, that was Stevie Veach and Olivia Strain speaking about precepting in community pharmacy settings, including how to integrate learners into the workflow and help them grow their skills. I'd like to once again thank you both for your time and insights today. Thank you so much for sharing with us.
Always happy to share to help preceptors and help students get the best out of their rotation.
Thanks, Nira. Really appreciate having me on today.